right now. Welcome, Dr. Nikki. How are you? Okay, so on your Zoom, you need to hit the little camera and the little microphone so we can hear you. There you
Okay,
are.
there you go.
You look great.
Oh,
Look
thanks.
what we have here.
Oh, my sweet Chrissy.
Say hi, Dr. Nikki. Are you going to give me a shot today? No.
Hey, no shots today, girlfriend.
Yeah, so we're talking to Dr. Nikki from the Galleria Animal Clinic about pet health, and there's so much that's new. Gosh, about a month ago, I thought I was going to lose Chrissy because she just sort of
Yeah.
froze up, and you said bring her in, and now she's on heart medicine. So
Yeah.
tell me what's new about that.
So, well, and new is maybe in the last decade. So, I graduated 12 years ago,
Okay.
and we sort of joked in school there was this new medication that was gold. And if you didn't know with heart disease, like this was probably it. And that it really has kind of become that. So, Chrissy, like many little dogs, has probably mitral valve disease. She's got valvular disease. She's got a murmur. Um, which just means that when your heart's pumping, you've got little valves that are supposed to close so that your heart, when it pumps, the blood can move forward. And hers are a little bit leaky. So when she closes them, they're not quite closed and her heart pumps and some of that blood goes backwards. So that's what we're hearing.
I
And
see.
so you have a question? Sorry.
No, keep going, keep going. I was just making sure we're recording, and we are. Okay.
So with that, a lot of times with these little dogs, especially, is when we get that backflow, we end up with more volume in the heart than is normal or that the heart is used to handling. So it ends up stretching in order to accommodate that. And as it stretches, those muscles get a lot weaker. So historically, when we've treated heart disease, we've treated it with diuretics, things to kind of pull fluid off, to dehydrate the animal, to make it where there's less volume.
Mhm.
But pemivendin works completely different. That's the medication that she's on, or vetmedin is the trade name for it.
Mhm.
Um, it helps to increase cardiac contractility, so it's helping to get her heart to pump more effectively. And so
Good.
it's been a game changer in treating heart disease. So I'm lucky. I've had it most of the time I've been practicing. We've used it a lot. I've used it with my personal dogs too, and I've seen amazing things with it. The
Wow.
thing about diuretics, pulling fluid off, is
Yeah.
that you're dehydrating the animal. So that can affect the kidneys too. And the kidneys don't really like being dehydrated. When we get these older animals, we're balancing multiple things. Some of them have kidney disease and heart disease.
Yeah.
And it's like, okay, like my heart wants to be dehydrated, but my kidneys need to be hydrated. And how do we balance that? And pemivendin has kind of changed that, where I can get these guys' hearts doing okay without stressing the kidneys any extra.
Oh my gosh, it is
So
a game changer. She's perked
yeah.
up. She's doing great.
Yeah.
And you also diagnosed her with Addison's, which when you said that, gosh, I guess it was, I don't know, 13, 12 years
It
ago
was,
or something.
yeah, it was a long time ago. She's done great with it.
Yeah, she has, but you had to find a balance. Explain first of all what Addison's disease is.
So Addison's disease is where the body is not able to make enough steroid. So your adrenal glands are not able to respond to the signals they're receiving in order to produce steroid to respond to everyday stresses. You know,
Hmm.
we think about steroids, oh, steroids are bad. Well, steroids aren't bad. Steroids help us deal with the ins and outs. When you're sick, your body can kind of increase them and help you feel better. I mean, it keeps you in homeostasis, it keeps you balanced. And when they're not able to produce steroids, little things that stress you that normally, you know, you feel personally your adrenaline goes up, they can't respond to that appropriately. And
Hmm.
so their body ends up with an abnormal electrolyte balance. And that balance is what gets really dangerous. And that's how we diagnose it. So, like symptoms of Addison's disease, it's hard to diagnose and it's not super common, but symptoms are kind of waxing and waning. You'll have on off GI symptoms. They're kind of doing okay. Maybe they throw up a little bit. Maybe they have a little soft stool. Then they're doing fine. So maybe they just ate something and we're not really sure. And it kind of goes back and forth for a little while typically. But blood work is how we diagnose that, looking at those electrolytes. And just because I look at those electrolytes one week doesn't mean a week or two that they're not different. So it's like if we're still dealing with an issue, sometimes it is important to recheck. And sometimes people get a little bit hesitant to that. So we've run that test already. Like things can change though, you know, they're not static.
Right. And I
So
remember I thought she had like dog flu because dog flu was going around at the time.
yeah.
And she was just so, she just wanted to lay around. And if we didn't treat her, that could have been deadly.
Absolutely, absolutely. That is something that they can get into what we call an Addisonian crisis, where those electrolytes do get so skewed. And the two electrolytes we really follow with that is your potassium and your sodium. And your potassium, if it gets too high, I mean, that'll stop your heart.
Yeah.
So same thing with them. I don't think Christy was in an Addisonian crisis when we diagnosed her. She was just starting to get that little imbalance. But I have had patients in an Addisonian crisis, and I've had them where we kind of suspected that's what they were dealing with, but we weren't totally sure. So we hadn't fully started treatment yet. And I mean, 3 days later, we were in an Addisonian crisis. It's like we rechecked those electrolytes, and all of a sudden they were way different. And it was like, okay, we've got confirmation now. We know that this is what we need to do.
Yeah. No day is boring for you, I bet.
It's not. It's not. You can never predict what's going to happen. When I first graduated, I would look at the cases for the next day, and I'd go home and okay, let me read up on this and read up on this and read up on this. And the next day, half of those had changed. People rescheduled, or the dog was better, or this, that, the other, and new things would come in.
Yeah.
So it's like you never know what to expect. You don't.
Yeah. Why did you want to become a vet?
I've always wanted to be a vet. When I was little, I just grew up loving animals. And, when I was little, of course, it was all about the animals. It was about the dogs and cats and whatever other animals I could get my hands on. And to some extent, it definitely still is. I mean, I love all of them. But for now, like more, and I think one of the added bonuses for me is how much the people are involved, because it's like these pets, they mean so much to the people whose lives that they're affecting. It's like our animals are with us all the time. When people let us down, they're there to snuggle with us and make us feel better.
Yeah.
When other things in life happen, it's like your dog and cat are there for you kind of unconditionally. And so it's just the people that I get to help and affect along the way, and then the people that I get to meet along the way too. Because it's like, some people I get to see monthly, and we get to do injections on their dogs. So we
Right.
we develop a longer term relationship, kind of a little bit more
Yeah.
frequently. And other people, it's like, okay, my kids are the same ages as yours, so it's like we're going through the same stages of life together. And I love walking with people, when you come in with this new puppy, and then we go through all these things, and hopefully it has a long healthy life, and then we get towards the end, and like, walking them through that and kind of coaching them through that, because I
Mm.
have been through it more than
Yeah.
most people.
Yeah. What I like
um
about your approach too is you don't just grab the dog and give him a shot. I don't even know that the dog has had a blood test. You just rub them and love them. Is that your own personal style, or is that something you learned in vet school?
I mean, a little bit of both. There are definitely distraction techniques, because it's like nobody's happy if the dog's feeling us give shots, feeling us draw blood, doing that. So it's like we try to be as sneaky as possible. And that's not that I'm trying to hide anything from the owners, but it's like if the dog doesn't notice it and doesn't react, then the owner's like, "Wait, you already drew blood?" It's like, yeah, we
I
were
did that.
talking, and
Yeah.
everything was fine, and the dog, they didn't react, because sometimes the dogs, when they react, they're reacting because we're reacting. It's like we feel for them, and the dogs are like, "Oh, I should be upset about this." Oh
That's
yeah,
true.
yeah, it's bad. And so it's like I try to minimize that aspect of it too, because
Okay. I
I
love
don't
it.
want it to be worse on anybody.
All right. And there is hope for uh dogs to have a little bit longer life these days, I guess. Is there some new drug or any other new treatments that people should be aware of?
So there is maybe a drug. I don't know if that's what you're hinting at. There's a drug coming out of like Japan that doesn't have FDA approval here yet.
Mhm.
I think there's been some Facebook articles and stuff about cats living to be into their 30s, and
Mhm.
I start to worry about quality of life there. And granted, we don't have that drug here yet, so I haven't had any. I have no personal experience with it. But we sort of joke with certain animals, if we live long enough, we're going to see this disease or this disease or this disease. And it's like, okay, are we just dealing with these diseases longer? And
Yeah,
it's like, I want to be very cautious about quality of life with
sure.
extending their life, because that matters so much more to me.
Yeah. Well, what I really loved was when I was kind of worried that that was it for Chrissy, and your receptionist said, "Come on, bring her back in because there's could be this, could be that," and I had hope, and she's doing great a month later.
Yeah.
So, people, I guess, don't give up. Is that a good message?
Absolutely. Yeah. I mean, because
Mhm.
a lot of times people will think something at home and like you said, I mean, oh my gosh, this is the end. They're doing this and this is what somebody else's dog did and they passed away. And I mean, of course things happen and that absolutely could be the case. And unfortunately we do have cases where it surprises us, like I didn't expect this to be the end and this was more serious than we detected initially. But I mean, without an exam, without doing some of those tests, sometimes, I mean, there's no way to know. So it's
Right.
like, I'm always, it's like, let me get the hands on the dog. Let me listen to them. Let me feel them. Are they dehydrated? Do they have any certain smells? There are certain things that can trigger us like, okay, we might need to look in this direction and see. But we have a lot of medications available. I mean, veterinary medicine has expanded so much. We've got specialties in everything. And obviously going to specialty practices is not practical for every individual and 100% we get that, but it's like we have internal medicine specialists, oncologists, neurologists. I mean, we've got it all at this point.
Mhm.
And so as a general practitioner, I try to dabble in a little bit of everything, and I love that because it does keep it interesting, and I can help people that can't go to the specialist for things. But it's like I love that I have specialists that we can kind of reach out to and get more information from. I can do CE with and kind of learn from them, like what are they experiencing. And I mean, absolutely, it's a ever changing field. And it's like, I can't wait to see what it looks like in 15 more years.
Okay. Well, and I also want to kind of end like talk about the puppy stage. Like people see a
Yeah,
dog, they'll see Blaze, the big white one, and everybody wants the dog. But it's important to know what kind of dog you're getting and what kind of dog will fit into your lifestyle. Wouldn't you agree? Have you
absolutely.
have you ever seen any disasters where the person and
Oh,
the dog
oh, we
don't
have.
match?
Oh, we have.
Uh-huh.
And probably one of the more common ones that I always catch on the tail end because people don't talk to me ahead of time necessarily is, people think, oh, getting two puppies because two puppies they'll be friends, they'll play together. And I love that concept. And for cats, yes, 100%. But for dogs, if we really want like two puppies, get one and do the training with it, put the work in, and 6 months later, get another one.
Oh,
Um, but absolutely getting a dog that fits your lifestyle. Because I mean, that's where some of our crossbreeds and some of our doodles and stuff, like which version of the breeds are we gonna get? We're not totally sure. And so kind of going into it knowing, okay, what am I looking for in a dog? And do I like to hang out and watch movies at night and, just chill on the weekends? Do I like to go hiking? And I need a companion that is good to go with me, especially in this Alabama heat. I wouldn't necessarily recommend getting anything with a little bit of a short nose. If hiking is what you want to be doing year round, then bulldogs, Frenchies, pugs, that's not it for you. To the same degree. I mean, Blaze has more energy than a lot of people have. So it's like, okay, we gotta use some of that energy and some of that smarts and kind
yeah.
of keep him entertained and mentally stimulated.
Yeah, and speaking of the heat, that is, I noticed, well, we kind of try to watch the dogs when we're walking. And it's
Yeah.
been a hot summer, of course, which summer isn't, right? So we're walking and we can tell that he's, labored breathing. We just turn around.
Yeah.
Are you seeing any problems with the heat this summer?
Knock on wood, we haven't seen too much. I think we've had maybe two that came in overheated, and we were able to bring their temperature down.
Mhm.
If you are somewhere and your pet gets overheated, doing running water is the best thing. So if that's possible for you, if you're at home and just kind of packing up to get to a vet or something like that, then doing like water that's moving on them because that helps with heat transfer versus just like sitting in water.
Okay.
But
Thank
doing
you.
that like on the paw pads, on the belly, things like that, that can help with kind of heat exchange. But definitely paying attention to the temperature. I mean, obviously, if it's too hot for us, it's too hot for them.
Mhm.
Earlier in the morning, later at night is a little bit better, making sure that they've had enough water before and after.
Mhm. That sort of thing. And what about food? I know food is a key component to good health and all of that. What's your opinion? I don't think I've ever really asked you on that topic.
So, my opinion, honestly, is what works best for your dog. I am not the biggest stickler on foods. If I'm going to recommend a diet, it's going to be one of the big veterinary brands. So Science Diet, Purina, Royal Canin, IAMS. Those are some good ones. There's a few others that have kind of come into play. Some of the boutique diets that, like we want to feel like, okay, we're giving our dogs the best and the best opportunity. Some of those are kind of working on marketing and don't have as much research and haven't been going as long. And that's not to say that they can't be great for your pet. I mean, they could be, but some of them have issues too. And so that's something that's individual that I'd recommend. Certain breeds are more risk for certain things. So it's like talk to your vet about that
Yeah.
and ask if you've got a particular thing. Now, if we have a picky dog and they're only going to eat this and this and this, and it's like, I mean, we're going to do the best we can to help that be as balanced as possible. And we do have veterinary nutritionists now. So it's like if people want to do a home kicked thing we've got ways to make that an appropriate balanced diet for them, make sure that they've
Oh,
got all the vitamins that they need.
right. Okay.
So,
And older dogs, speaking of that, yeah, we're struggling to keep pounds on Chrissy, the little.
yeah.
So, you recommended some puppy food just for extra calories. That's
Yeah, but it's just higher in fat. It's meant for growing. And so, yeah, when we've got, and I mean, I wouldn't say any dog that's older losing weight to just jump to puppy food by any means, but it's like after we talked about it, we kind of found her cause for losing weight because the heart disease will do that. And it's like, okay, how can we get some weight on her?
mm-hmm.
And not all of my heart disease patients need extra weight. Some of them
Right.
are already carrying a little extra and we don't want to stress the heart. But it's like Christy was losing weight. And it's like, okay, no, we needed her to gain a little bit. And like I said, puppy food's it's growing. So it's in all life stages technically. But it is higher in calories, higher in fat than some of the other ones.
All right. Well, you know what? You have been so nice to talk to us, and I know you have just the best people that you work with. How many dogs do you have?
I have six.
Oh,
I
is
have a
that
house
all?
full. So
Six.
I love dogs. I have a variety. I've got them from 5 pounds up to my 6 month old puppy that's 70 pounds. He's a growing boy. So we have a variety at our house. And like I said, I love them all.
Yeah,
So
and he's huge.
he is huge.
What is his breed? I've seen.
He's a Scottish Deerhound. So
Okay.
he is it's a leaner version of an Irish Wolfhound. Most people have heard of an Irish Wolfhound, and most people haven't heard of a Scottish Deerhound.
Uh-huh.
But they're just a skinnier, kind of daintier version
Uh-huh.
that we fell in love with when we met them. So
Well, I hope this interview gives a lot of people encouragement that there are options and don't give up too soon on your pets and good vets like you just are like gold. So we thank you, Dr. Nikki, for joining us
yeah,
today.
absolutely. Thanks so much for
And
having me.
all right, Galleria Animal Clinic, the best. Okay. All right, we'll talk to you soon. Chrissy will be in
Okay,
for her shot.
we'll see you
Okay.
soon.
All right, thank you.
Bye.
Bye.
We'll see
Okay.
you soon.
All right, thank you.
Bye.